Addiction doesn't just take lives, it takes hopes, families, and futures. Opioids in particular are causing droves of overdose deaths in the U.S. Overcoming life-threatening addictions to drugs and alcohol is possible through long-term treatment and support. Change is possible. Industry expert Jamie Lamb explains.
Addiction in America is so prevalent that it has now been named an epidemic. In the United States, we see approximately 17% of our population diagnosed with a substance use disorder. That is 48.5 million people. And likely half of them also have a co-occurring disorder. The root causes of addiction are numerous and multifaceted. What we usually find is that genetics play a huge role in addiction. What we see for a lot of our clients is they weren't able to get the proper diagnosis and treatment for a mental health condition, so they started to self-medicate. And in that self-medicating, they find themselves now struggling with an addiction. I believe that what is needed is for people to understand the nature of addiction as a disease. We need to educate people about that. Recovery is within reach for everyone. No one is too far gone. If somebody has the courage and has made the decision they don't want to continue living as they are, reach out for treatment. Call Cedar House. We're here for you, and we will do our very best to guide you in the right direction.
Cedar House Life Change Center is a recovery center offering long-term care from drugs and alcohol. This nonprofit has been providing services since 1973, starting with 9 men who wanted to start the journey of helping people detox and educate on the dangers of alcoholism.
Cedar House has been serving the most vulnerable of our population in our communities for more than 52 years. Back in 1973, 9 gentlemen, most likely in recovery themselves, decided that they wanted to help men who had alcohol problems. So they started a 12-bed facility and called it Amigo House. Now we are a multi-facility organization serving adult men and women with substance use and co-occurring disorders. We provide detox, residential, outpatient, overdose prevention, medication-assisted treatment. These are programs that have been added over the years so that we can meet the needs of our people. Because Cedar House has been so successful, we have been awarded a grant so that we can now break ground for another 70 beds. In addition to that, the facility will help us to expand what we currently do and add more.
Working here at Cedar House, I've been able to see a lot of clients come into treatment with the opioid use disorder. 19 years ago, opioid use disorder was usually heroin. That was the main drug of choice. Since 2019, we've seen an increase in fentanyl users coming into treatment. Fentanyl is 50 times stronger than heroin and 100 times stronger than morphine. It is destroying our families, devastating our community, and killing our loved ones.
The role of community in long-term recovery shows that social support and connection play a critical role in sustained recovery from substance abuse disorders. Peer support groups, alumni networks, and wraparound services help prevent relapse and promote long-term well-being.
People use drugs and alcohol to cope with trauma. They've learned at an early age that being able to use and to drink allows them to escape that trauma for a little while. We're targeting the mental health symptoms, the trauma, the medical issues that have gone unattended, and helping them stabilize so they can achieve recovery. What's really important is that we humanize people struggling with addiction. Society tends to stigmatize people and look at addiction as this issue of bad behavior or an issue with morality. And when we bring people in, we allow them to feel that they're just like anybody else.
Addiction is considered a highly treatable condition, and recovery is attainable. Of the 30.5 million adults in America who feel they have or have had a substance abuse problem, around 22 million, 73.1%, say they are in recovery.
Hi, my name is Tammy. I am an addict. I grew up in a home where drugs was just the normal type of life. I was indulging in crime and living on the streets. I came to Cedar House in 2019, and this is where my journey began. The staff here really helped me. They encouraged me. They came along beside me. They gave me that strength that I didn't even know I had.
My story started with Cedar House on November 2nd of 2018. I spent about 10-15 years of my life struggling with alcohol on various levels. When I came here, I was utterly broken. I'd never gotten the help that I needed. So I spent 111 days as a client here at Cedar House. They've been my cheerleaders. They've been there to support me when life threw curveballs at me. Cedar House has always been there to help.
Begin your life anew at Cedar House Life Change Center. Our supportive environment creates a safe space for everyone who walks through our doors, searching for more than just treatment. The network of caring individuals become family to our residents. You can foster deep, lasting connections that extend well beyond the recovery period at Cedar House Life Change Center.
Cedar House Life Change Center provides evidence-based treatment to empower those affected by addiction. The need has never been greater. We see people every day, success stories of people who come to us feeling completely hopeless, and we give them the tools and techniques to turn their lives around. At Cedar House, we always say recovery is within reach.
To find out more about Cedar House Life Change Center and the road to recovery, please visit cedarhouse.org.